My name is Grace Hill, and this is my disease presentation for Microbiology 275. My presentation is on Legionnaires disease. We'll briefly go over the history, characteristics, and disease itself. So, for the history, in 1976, in the summer of 1976, the American Legion had a convention in Philadelphia. And shortly after the convention, all these people that attended, the Legionnaires, had become ill. There was approximately 182 individuals who became ill, and 29 of them had died. By the fall of 1976, Dr. Joseph McDade, he was a microbiologist for the CDC, was still stumped and was a bit frustrated and wanted to figure out what was going on. And by the end of the year, he was able to isolate the pathogen that caused all these individuals to become ill, and unfortunately, 29 of them to die. So, in honor of the Legionnaires who fell ill, that's what he named the pathogen. So there are three subspecies and 16 serogroups. It's an intercellular pathogen, and it does test as a gram-negative bacterium. It's aerobic and helomorphic. So what that means is it can change shape and it's able to maintain or it's able to survive harsh aquatic environments. And part of being able to survive these harsh water aquatic environments is they attach to biofilms, and that allows them to deal with the harsh environments and increase their resistance to it. So they're able to survive in temperatures of water as low as 15 to 50 degrees Celsius, but they thrive, excuse me, as low as 15 degrees Celsius, but they do thrive the best in warm water, roughly around 25 to 45 degrees Celsius. They're this little short rod, 3 to 5 um, micrometers in length, and in the lab, they have been known to grow as long as 10 to 25 in length. So how did it cause a disease? Well, the bacterium that Dr. McCade isolated was called the Legionella pneumoniaphila. I totally butchered the name. It's very hard for me to pronounce, but essentially, this bacterium does it is the culprit for the Legionnaires disease and another one called Pontiac fever, which is not as serious. It's still you get sick, more like the flu, not nearly the chances of being fatal like the Legionnaires disease. So, in order to get these diseases, um, the pathogen lives in these natural water aquatic environments. They can live in potting mix because potting mix, when stored, it has a lot of moisture in it. Artificial water systems, such as our AC systems, our heat systems, hot tub, shower heads, hot water tanks, anything that holds moisture, even at businesses in those water pipes. So if you have a company that provides a water filter for employees to get water, this can house in that water system where you're getting water from, especially if no one has cleaned it. The bacterium, once it enters the human body, um, we it targets these immune cells that are in the lungs called the alveolar macrophage cells, and they also target epithelial cells. So essentially, what it's going to do is it targets these cells, infects the cells, and goes inside of them. And then within the cell, it multiplies. So it's attacking our immune system and multiplying inside of our immune system. So then it's destroying essentially our defense to this bacterium, thus causing us to be sick. So, in order for us to get it, though, we would inhale it from like mist. So, like a steamy shower. And if your pipes have contamination, then you're going to be inhaling it through the mist from the steamy shower. Or maybe it's contaminated in the hot water tank. So, anywhere that's going to be creating some sort of mist and you inhale it, that is your chance of getting sick. So the pathophysiology is it's an intracellular replication, meaning that it continues to replicate inside of the target cell. So when it goes inside these immune cells, it's just multiplying and multiplying. They consider also acute lesion. So what that means is it's a fibronopurulent bronchopneumonia, and that is basically means that the alveoli fill up with fibrin, neutrophils, and macrophages as it's multiplying. And then the inflammatory response is going to be similar to the bacterial pneumonia. However, it has a necrotizing component to it. Some virulent factors, it secretes toxins, pigments, enzymes. Like I said earlier, it survives in biofilms, which will increase the resistance to harsh environments. So those really warm and really cold environments, they're going to be able to resist it and not die. It does have motility and it has flagella, pili, and an outer membrane protein. Here's a picture of what they look like underneath the cell or underneath the microscope. So, in order to identify if a human has been infected, there's a couple different things. It's diagnosed by a urinary antigen detection. We can also do a chest X-ray to see if a patient does have pneumonia, since there are several different types of pneumonia. However, the X-ray won't tell us if they have this specific pneumonia. In order to find out if we have this specific pneumonia, a sample of sputum, so your phlegm or urine, needs to be sent to the lab and tested. You can also do a blood test. The blood test will tell you if you've been exposed, but not if you have it. If you provide a sample of sputum or urine, some of the tests is going to see if it's a gram negative stain result. They're going to use selective media, which is BMPA and MWY. They're considered the most sensitive and is recommended to test for this pathogen. They're going to also see if the bacteria collected would fall under the category of a paleomorphic bacillia. So, some symptoms and a treatment plan. Many people are asymptomatic. However, if you do have symptoms, you're going to have your typical cough, fever, chills. You're going to be short of breath, possibly even feel like you have an elephant sitting on your chest. A lot of people I hear that have pneumonia feel like an elephant sits on their chest, basically. Some muscle aches in your chest, um, some headaches and diarrhea. And in order to resolve all this, you need to have an antibiotic treatment plan. There are about four different antibiotics that can be described or prescribed. However, you do want to be treated as soon as possible because this type of pneumonia is considered one of the most high risk and fatality ones. So it is a very dangerous one. Some interesting facts. The most common way to be infected is through a dental office from the water that they get in the instruments. Um, so, yeah, that was kind of weird to find. Makes me concerned about the dentist now. Another fun fact would be back when, before it was isolated, it was almost labeled as the monster killer by the press in 1976 during what they deemed as the Philadelphia epidemic. And to date, there's over 60 different species identified. Another fact would be that it is a very uncommon form of pneumonia and it is vastly underdiagnosed. And then when COVID happens, they found that there was tons of co-infections with the COVID-19 patients. And after the world started opening back up, they saw an uptick in cases with people with this type of pneumonia because all these office buildings were sitting vacant, unused. And who knows how long it was since the last time they've been cleaned. But there was an uptick because of that. And that concludes my presentation. I hope you enjoyed it. And if you have any questions, let me know.